the body's activities, metabolism, reproduction, growth, and development. It also helps us to adapt to changes. You already said it does that by hormones. I know that the pituitary gland, the pineal gland, I know all that. That's not what we're doing today. I hope y'all got some of that in Adult Health 1. If you didn't, you got it in A&P 1. That's not what I'm talking about. So, the hormone has target cells, organs, and organ systems. And it produces the effect by going to where it wants to go. Now, this is important. How does it do that? By what kind of feedback? Negative. There is one thing that goes by positive feedback. Does anybody know what it is?
Does it have to do with birth?
Mm-hmm. How's baby get out? What yeets the baby out? What muscle? The uterus. The contractions get stronger and stronger and stronger until what? Baby's yeeted out, then it stops. So, all the hormones, and it's like I said, if it was negative feedback, the baby never come out, right? So, that is the only one hormone that causes a positive feedback. And basically, this is a thermostat in your house. You set it to 70 because it's hot. AC comes on, cools it off to 69.5, and then what? It cuts off. If it didn't cut off, your light bill would be $550,000. Negative feedback. Your blood sugar is 500. Your pancreas says, oh God, I need some what? Insulin. If it kept secreting, what would your blood sugar do? Bottom out. Negative feedback. It gets back within range, 110, and it says, hey, cut it out. Negative feedback. It stops the hormone until what? I eat all the cake. Then it starts again. Every one of these other hormones are via negative feedback loop, just like your thermostat. There's a trigger. Blood sugar is 550,000. There's a response. I need some insulin. There's an action. When I get it back down to where I need it to go, with that adjustment, it turns it off. This is it. You either got too much or not enough. And there are names, and most of them are either hypo or hyper.
It's gonna be a hell of a note if I have to be on crutches. Especially since I'm supposed to take my kids to a water park next Saturday. Monday, Tuesday, Wednesday. It's gonna be interesting.
So, if you got hypertension, your blood pressure is too high. So, under the realm of too much hormone, you got hyperthyroidism, SIADH, hyperparathyroidism, Cushing's, pheochromocytoma. Under the not enough or too low of the hormone, hypothyroidism, diabetes insipidus, hypoparathyroidism, Addison's, and adrenal insufficiency. I put these up here so you can start looking at them to remember which one is too much and which one is not enough. But on the slides, I have put them one after the other. Here again. What is the hormone from the thyroid gland? T3 and T4. What labs do we draw? T3 and and T4. Have y'all ever had somebody come in, a heart rate's real rapid? What labs do they draw? They do draw troponin. Have y'all ever seen them draw a thyroid panel?
Yes.
I promise you they drew it. If they worth their weight in salt. Why? What are they looking for?
To see if you have a thyroid condition.
Because if you have a hyperthyroidism, your metabolism is what? Amped up. Your heart rate would be fast. Your thyroid gland has to have what to make what? You have to have iodine. Back in the day, we didn't have what in the United States? What did we do to solve the problem? We added it to salt. We ain't got that problem no more because we eat way too much salt. Y'all know why old people eat too much salt? That's the first taste that goes away. That's why your grandmama sitting there going, "Girl, have you seen so and so?" And then they got like this much salt in there. That's because they can't taste it. But easy fix. I don't remember what year they did that. I think it was during the 50s. They added iodine to the salt, got rid of that problem. Without iodine, you can't make the thyroid hormones. The adrenal glands, guys, I know that it does more than make these two. It also makes the androgens, which are the sex hormones. We ain't talking about sexy time in here today. We're talking about these two. The parathyroid hormones regulate which one? Calcium. I know that it's showing you where these come from. That's showing you that it comes from the pituitary gland. I'm worried more about the hormones here. Cortisol, aldosterone, anti-diuretic hormone, T3 and T4, parathyroid hormone. I always have problems with that word too. You have to have iodine. What if you don't have iodine? What's it going to cause? Goiter. Why do you think it would do that? If that gland does not have that, oh my God, it's like I'm going to work 30 times as hard. And what happens? What happens to your heart if it is like working? Cardiomegaly. There you go. You can only work so hard for so long and it starts to do what? Stretching out of place. It's the same process.
Can you make it smaller? Can you make a goiter smaller? Like, does it go down at all? Because if you think about your heart, it doesn't inflame, like, a large heart doesn't go down.
I don't know. Somebody look that up. Can you, I wonder if you have to do
Like a surgery?
surgery. That's a great question.
Well, I guess it would depend, like if glands are smooth muscle.
Medication, surgery, or radioactive iodine.
So she said medication, surgery, or radioactive iodine. I wonder how much it shrinks it though, because I have seen goiters that are like, what do you think that might affect?
Your breathing, your swallowing.
Sitting there.
What's right there?
Your airway.
Your airway, if it got bad enough. Hyperthyroidism, high metabolism. Basically, you can think of this as your sympathetic nervous system is engaged. Every sign and symptom. Heart rate is high. Respiratory rate is. You think they're going to be gaining weight or losing weight? Losing weight. Heat intolerant.
Yeah.
Yeah, because they sweating all the time. They can't stand it. I'm hot, having a hot flash. Too much.
Not to be confused with Ozempic.
Right. Too much T3 or T4. What is this?
Grace, is he your eye?
It is. It's called exophthalmos. Is your eyes bulge out. It is an autoimmune disease. It is the #1 cause for this. If you have thyroid nodules, a lot of times those are precursors to what? They turn into thyroid cancer. A lot of times if you have several nodules, they will do surgery. Thyroiditis, too much iodine. You don't eat too much salt. Every presentation is high and hot. So if this is high and hot, what you think hypothyroidism is? Low and slow. This is your Graves' disease. If it gets so bad, and a lot of times, who do you think notices this besides their loved ones?
People that wear glasses.
They go to the eye. I love you. He said, people that wear glasses?
I'm trying my best.
I know, I love you. Now they go to the eye doctor, and their eye doctor's like, I mean, because they all up in your grill, right? When they're in the little click thing. I hate those things. Better or worse? I'm like, I don't know. It looks the same.
The worst one is the air one.
I know. I hate that. Guys, once they really get bad, guess what doesn't happen? They don't go back. Can you imagine? Why do we blink? To re-wet your eyes. Imagine if you never could re-wet your eyes again.
I'd be more cranky myself.
I'd be cranky too. What's going to happen to your cornea? It's going to scar, it's going to scratch.
So they lose vision.
They can. You have to do a lot of re-wetting and covering and everything else. Hopefully they will catch it before then. And what else do they have to wear everywhere they go outside? Sunglasses. Even if it is a little bit, it doesn't go back. High heart rate, high blood pressure, heat intolerance. So, if everything's high and hot, what's high for your GI system? Diarrhea. What's the opposite of diarrhea? Constipation. So hypothyroidism. Do you see what I'm telling you on these? It's opposite. Palpitations, and it can form a goiter. You're going to see that on both of these, and I'll explain that when we get to the other one. You can just go ahead and write monitor vital signs on every one of these. If their heart rate is 160, you can say you're going to monitor heart rate and vital signs, blood pressure. So basically, if they have nodules, or if it is if it is cancer, that radioactive iodine therapy can kill it. Sometimes there ain't no fixing it. Sometimes the surgery goes in and removes it. Now, do we need that hormone? So if I remove it, what am I going to have to take? Replacement hormones. They might have to have surgical interventions. Now, do they always have to remove all of it? No. Sometimes they can just remove partial. They are going to do T3, T4. What is this? Thyroid stimulating hormone. That one is not as important as that one. So, radioactive iodine uptake test. If this is on crack, how much of this you think is going to uptake? A lot. I cannot pronounce that medicine. I have tried and tried and tried. I guess I need to get on there with a little speaker and listen to somebody else say it. Hey, what's that, PTU? This one is very important, and I'm going to show you in a minute why it is very important. Why these three? What are those three? Beta blockers. Why do you think? You got, now, is this just treating the side effects? It is, but if your heart rate's 170, how long can it stay that way? Not a long time. These actually treat the high T3 and T4. These treat the fallout. There is one complication that will kill you. It is an absolute emergency. Does anybody know the name of it? It is a thyroid storm. They call it a storm for a reason. I have seen it once, and we damn near couldn't save the person. Guess one of the times this can happen when you do the surgery to take this out. If you get in there and start mucking with this gland, guess what can be dumped into your system? A massive amount of T3 and T4, which is probably not a good thing, right? So if your heart rate was 170 now it's 270. Here we go. I'm taking it out. And now guys, sometimes you can't help it. Guess what they might give them before they even do the surgery? PTU. Because that's the number one thing to cause it. And it's not like you can go in there and say, I think it's coming out. Infection, thyroiditis. If you take your anti-thyroid medicine, you say, I ain't taking this no more. Radioactive iodine therapy. If they're trying to kill the thyroid gland and it says, ooh, I'm going to dump all this out there at the same time. Tachycardia. I ain't talking about 170 over 105. I'm talking about like 270 over 150. I ain't talking about 101.7. I'm talking about 105 degrees. And like your brain starts frying at 105, 106, 107, not 105, 106, 107 degrees. Not just agitation, psychosis. They try to whoop your tail when you come into the room. Wrong way. Why do you think Tylenol is not effective? It's not really a fever. What's causing their temperature to rise? Their metabolism. What do we normally get a fever from? Inflammation, infection. You got to bring that down. That is not this. It might bring it down like this much. That's not the problem. Now, they need this medicine bad. That's what's going to save them. PTU. I think this one is methadone. Why they got to name all these drugs such hard names? Bethazole. Thank you. This one doesn't have as profound effect as this one, but a lot of times if it's a thyroid storm, they will give them together. And again, beta blockers. They've got to bring that heart rate down, but that one treats more of the fallout. The other two start blocking the T3 and T4. The other one's high and hot. You've already said it. This one's low and slow. I had too much. I don't have enough. Hashimoto's. Now, this does come from the pituitary. The thyroid stimulating hormone comes from the pituitary. Just remember it's a tumor. Lithium, if I take out the thyroid again, it might not produce any. There again, what do I have to supplement with? Thyroid hormone. Does anybody know the name of it? Synthroid, levothyroxine. This is the only medication that I can think of that I have ever heard the physicians say they don't like the generic. I don't, and if anybody's on the generic, I don't know. But I have heard them say time and again, they want the Synthroid, not the generic. And I've never asked them why. This is a medication you need to take at the same time every day. If you take it at night, you take it at night. You can't start missing doses. So we were tachycardic, now what are we? Bradycardic, hypotension. You was running around cleaning up the house earlier, and now I can't get off the couch. This might slow down so much what? You might not have a menstrual period anymore. Why might this matter to some people? You can't get pregnant. And if you don't know that you have this, right, you gain weight, you don't have any energy to do anything, and you're not having a menstrual cycle. So you don't know why you're not having children. You have a low temp, your skin is dry. We had diarrhea before, now we done got on the other side. You're so constipated that you're miserable. Here again, what if their heart rate was 30? What are you going to give them? Atropine. Guys, you can't list all the meds that you might treat the things. They're going to get levothyroxine, which you've already said is Synthroid. Diagnostics, T3, T4, thyroid stimulating hormone. They're going to have to get thyroid hormone replacement if it's that low. We had a thyroid storm before. What's the ultimate low and slow? One step above dead. Coma. Myxedema coma. That is the complication that we don't want. Thyroid storm is the acute emergency. If you're in a coma, what is the priority? Airway. Y'all might want to remember that. Immediate priority. And it's not an oxygen mask. It ain't a nasal cannula. You need to prepare for what? Immediate intubation. And I know that somebody asked a question earlier or on the test, Ms. Horton, I can't intubate. Guys, I know that. It didn't really ask you to intubate. It said prepare for intubation. Even if it says you're going to intubate, I'm not saying you are. So don't take that question that way and think it's wrong. If that is what you need to choose, then choose it. If that is a priority, I am telling you, choose it. I'm not saying you're going to do it. I'm saying that's the priority. Does everybody understand that? If the first thing that I need to intubate them and ventilate them, then damn it, do it. Don't second guess that by thinking I can't do that. Yes, you can on my test. Y'all can all intubate somebody, jump up on the end of the bed and say, let's do it. You got a handle in this bed, an ET tube in this one, say we're going to do it right now, right now, right now. What? Y'all don't do that in the emergency room. Kick Miss Metcalf out of the way. Say, I got this right now. Y'all get the IV, get some sucks, get some vet. Woo! She gonna be like, grab him and haul him out in the hallway. I don't know what Miss Horton been telling y'all. I'm gonna have to call her on the phone. No, she be like, woo, let's do it.
You know the pediatrics, you can't show the weight of the kid and you have the little sail tape. That'd be neat.
Oh.
This big, blue.
They this big. Let's do the blue one. Myxedema coma. They will stop breathing on you quickly. Because they're going to get bradycardic so quickly, their heart's going to go down, their respiratory rate's going to go down, they're going to go into respiratory arrest. Like they probably just going to skip right over respiratory distress and failure. They're just going to stop breathing. Hypoglycemia, hypothermia, respiratory arrest. I hate this word
Because you're always like, what's a ton, dude? Hey, mom, what else leave? No, you out. Respiratory arrest. You have to replace the thyroid hormone. I'm going to make IP central. Prepare them for intubation. How are we going to rewarm them? The bear hugger, they make rewarming. Somebody said rewarmed IV fluid, yes. Atropine for the bradycardia. Now this is just treating the fallout. They have to have that thyroid hormone. That is nothing is. You have to treat what? The cause. Now this is gonna keep them alive till we can treat the cause. So I ain't saying I ain't giving them that atropine until you can give them that.
So would you intubate and then give a thyroid hormone, or give the thyroid hormone and then intubate?
Somebody's running to get it. You've got to intubate them. Now this is always a group effort, right? Because it ain't never gonna be in there when you need it. But don't wait on one for the other, because they will stop breathing on you. I have never been in the room when this has happened. I've had co-workers that said that they've had patients that did this, but thank God I've never been in there. Because guys, this kind of stuff is ugly. And it's not something you expect. Because these people just come in off the street and they're bradycardic and not breathing, and nobody knows why, right? Because what if they don't know they have thyroid problems? I just been gaining weight, my menstrual cycle sucks. I don't know why. I just don't have any energy. They have no idea what's wrong. What did we say your parathyroid gland controls? Every sign and symptom has to do with what? Calcium. Is either high calcium or low calcium. What electrolytes are in sea salt? Calcium and phosphorus. Phosphorus is high, calcium is low. Where are your parathyroid glands? Right behind your thyroid. You get to messing with your thyroid, guess what you messing with? A lot of times your parathyroid glands get messed with. And vice versa. You get to mess. And guys, I always thought they're huge. They're like as big as the tip of your little finger. They are so easy to get disrupted when they're trying to do surgery on the thyroid gland, or even to get removed. So, what is the hormone that they produce? Parathyroid hormone. Hypo, I don't have enough. I'm not so much worried about the phosphorus. I'm worried about what? The calcium. Here again, I have taken the thyroid gland out. A lot of times they can't help but take the parathyroid glands out. Sometimes it might be an autoimmune. I've had radiation treatment that has damaged the thyroid, and there again, it has fallen right in line and damaged that parathyroid as well. I asked you a second ago, what causes every sign and symptom where it's too high or too low? That calcium. Remember when we said, what effect does potassium have on the body? What does it target? The heart. Contractility. What does calcium target? Muscles. What is the ultimate muscle contraction? If it don't stop, what is the ultimate muscle contraction? Tetany.
Oh.
What are your lungs? Smooth. You're not gonna breathe. Before tetany, what's a really bad muscle contraction? Seizures. Do you see where I'm saying this is bad juju no matter what you're talking about? Hypocalcemia. Y'all remember when we talked about Beck's triad and how NCLEX loves this? I think every student has come back and said, Trousseau's and Schwastek is on every freaking NCLEX that has been out there for every year that is there. What is that one? No, you can always remember the cheek is Schwastek. It starts with a C. I think I'm correct. Trousseau's is what? You put the blood pressure cuff and it does what? Y'all might want to remember both of these. They're important on the NCLEX. It's going to be on my test in some form or fashion. Yes, you. They call it carpal spasms when you blow up that blood pressure cuff. So what about this one? You tap it, and it causes what? It irritates that muscle, and yes, it does that. It makes that cheek draw up.
Is there
What?
just which one? We're just trying to figure out which one says for high or low calcium.
This is hypocalcemia.
That GPT, alright.
I gotta write my evaluation. You see it? That's Schwastek. That's not that obvious. This is agonizing. Seriously? I think so.
They're gonna pump it up.
So it causes that flexion in when you pump it up. So when the calcium is low, like I said, it makes all the muscles irritable. The way you can remember Schwastek is it starts with a C, and that's tapping the cheek. The first signs and symptoms are tingling, burning, and twitching. So if you have ever, or if you've ever been with a family member that has had thyroid nodule surgery, the nurse is going to tell them what? Hey, if you have circumoral, which means what? Around the tingling, burning, or twitching, I need you to tell me. Why? They have been mucking with the thyroid and might have mucked with the parathyroid. If they're having this, then what has happened? Their calcium is dropping. If they don't tell them what's going to start happening, it's going to keep dropping, and sooner or later, the ultimate bad is tetany. And they won't start. clonic, then tetany. What are seizure precautions? Pad the beds. They'll have pads on the floor. Suction in the room. Oxygen in the room. What else? Loose clothing. If their muscles are irritable, have y'all ever been overstimulated? And you like, oh dear Jesus, if one more thing. Their entire nervous system, because their calcium level is one more thing. And if they get overstimulated, guess what they're going to go into? A seizure. Bright lights, loud noises. What kind of environment do you need to have? Quiet. Don't go in there yelling, screaming, talking, and if their family member is in there doing that, you need to do what?
Take them out.
Either talk to them and tell them, and if they don't do it, they need to be asked to leave. Because if they start having seizures, they're going to hurt themselves. What kind of diet? High calcium? Low phosphorus. Why low phosphorus? Has anybody got a soda in here? No, it needs to be a brown. Guess what's in brown soda? Phosphorus.
Really?
Yep. Because if you have renal failure patients and they're on dialysis, they will tell them, do not drink brown soda. They don't want their phosphorus to go up. Full set of vital signs. EKG. Monitor for what? Neuromuscular irritability. Cardiac monitoring. We are got is calcium in this?
No.
It's not. We are going to do magnesium. Phosphorus is not in that either. You remember they, I think Mr. Lomax might have mentioned this. I might have mentioned it. You know the little machine that a lot of ERs and ICUs have? The iStat? A lot of them have cartridges that will draw a calcium. It's not perfect, but it's a lot better than waiting 2 hours to get that calcium, ain't it? Now, if your patient is in tetany, what do I need to give them immediately? Calcium. A lot of places say calcium gluconate. I'm going to tell you, you can either give calcium gluconate or calcium chloride immediately. Why vitamin D? It helps absorption. All right. Hypoparathyroidism. Calcium was what? Low. Hyper. How do we get calcium in the bloodstream? How does it get it from the bones? You ain't got to go all technical.
From the blood?
It does what?
From the blood?
It breaks it.
It carves it out of the bones, right? So if I'm carving too much, yeah, see, you got it. If it's carving too much, what is it going to do to my bones? Makes them brittle. So, if I have too much parathyroid hormone, it's carving too much, what might I be predisposed to? Fractures. Now, can be caused from a tumor, either non-cancerous or cancerous. You're having some sort of GI issues, malabsorption of cancer, renal failure.
So if they have too much calcium but low phosphorus, can they have a SODI?
So,
Yes.
if their phosphorus is low and their calcium is high,
It's okay.
what
But if they're in renal failure,
Soda.
I don't know if it would help.
DC a day keeps the doctor away.
There you go. I don't know.
I'll try it at work, see how it goes. I'll let you know.
Don't kill your patient and be like, it's hard coming to do that.
Hold on, we'll do this.
So the way to remember this is you have painful bones, groans, and stones, and bones. Bones, stones, groans, and bones. So remember we said it's cleaving too much from your bones. It makes them brittle. Does anybody, I hope nobody has ever experienced this, ever been around anybody that has cancer of the bone? I have been around someone who did, and several people, and they said it's the most painful type of cancer. Bone pain is the most deep-seated, nothing helps. They gave them so much narcotics, I'm like, I think everybody in this classroom would have stopped breathing, and it didn't touch it. It hurts. What are kidney stones made out of? Calcium. Because the first thing that happens if you have a whole bunch of kidney stones, they tell you what? Stop drinking milk, soda. No, actually they tell you to stop drinking tea.
Oh, yeah, because that has.
Tea and milk. But it makes you form a whole bunch of stones, which can lead to renal failure. Too much calcium makes you throw up, nausea, vomiting, indigestion. It sounds like every bad drug side effect. Constipation. Somebody said the effect on the nervous system. It does in this case. Lethargy, fatigue, memory loss, psychosis, and I mean it's got both ends of the spectrum here. So, painful bones, renal stones, abdominal groans, and psychiatric moans. But it's because the calcium is what? Too high. I need to get that blood calcium down. Oh, look at here. IV phosphate. If that parathyroid gland is producing way too much, we're going to do what? Take it out. What do I run the risk of doing? Getting too much thyroid hormone dumped out. Do you see how these two are so intertwined? So I'm going to take this out and I ain't going to have no more problems. Well, then it dumps all these T3 and T4 and now you're in a thyroid storm. You can't help it. You have to take it out. These patients have to have adequate hydration. What kind of labs? What would be the top 3 labs? That's the first one I want to know. Calcium level, CMP, phosphorus level. I've never had to draw a parathyroid hormone level. I don't even know what color tube it would be. I had to look that up.
Hold on, can you say that again about?
She said if you take that parathyroid out, then you're gonna just down
Thyroid?
If you start messing with the parathyroid glands, what can you hurt?
Oh, your thyroid.
Yeah, because they're right there attached. So you can make it dump T3 and T4. Just like we talked about, if you're taking the thyroid gland out, you can cause it to dump parathyroid hormone. They basically sit on top of each other. So you have to be very careful when you're doing either one.
I love this. I found this.
Guys, I know this was quick. Do y'all have questions about this? What do I want you to remember?
I want you to remember too high or too low. I want you to remember what it's called, because it ain't always hypo and hyper. What does it control? What effect does it have? Metabolism, calcium. When we get on the other ones, it will be cortisol and aldosterone, or anti-diuretic hormone. But if you think about that, what is that word? Anti-diuretic. If you're taking a diuretic, it makes you anti-peeing. You ain't gonna. So if I take that away, you're gonna pee a lot, right? If I'm taking an anti-diuretic, I ain't gonna pee. If I take all of that away, I'm gonna pee everything. Does that make sense?